Anatomy of the vagina. Today, we'll be discussing the anatomy and functional aspects of the vagina, an essential component of the female reproductive system. This structure plays multiple vital roles not just in reproduction, but also in excretion and physiological interaction with adjacent pelvic organs. Let's begin by looking at the definition and orientation of the vagina. The vagina is a fibromusculumbrous sheath that communicates the uterine cavity with the exterior. At the vulva, it acts as the excretory channel for uterine secretions and menstrual blood. Importantly, it is also the organ of copulation and forms the birth canal during parturition. Anatomically, the vaginal canal is directed upwards and backwards, forming an angle of about 45 degrees with the horizontal in an erect posture. The long axis of the vagina almost lies parallel to the plane of the pelvic inlet and is at right angles to the axis of the uterus. In terms of size, the diameter of the canal is approximately 2.5 centimeters, being widest in its upper part and narrowest at the introitus. Despite its usual resting shape, the vaginal canal has considerable distensibility, a feature dramatically evident during childbirth. Walls and fornices of vagina. Structurally, the vagina has 4 walls, an anterior, a posterior, and 2 lateral walls. The anterior and posterior walls are typically opposed together, while the lateral walls are stiffer, especially in the midregion. This anatomical arrangement causes the vagina to appear H-shaped in a transverse section. The length of the anterior wall is about 7 centimeters, whereas the posterior wall measures approximately 9 centimeters. At the upper end of the vaginal canal, we observe the fornices clefts formed at the vaginal vault due to the projection of the uterine cervix through the anterior vaginal wall, where it blends inseparably with the wall. There are 4 fornices, 1 anterior, 1 posterior, and 2 lateral. Among these, the posterior fornix is the deepest, and the anterior is the shallowest. Anatomical relations of vagina. Now, let's consider the relations of the vagina to adjacent organs. Anteriorly, the upper 1/3 of the vagina is related to the base of the bladder, while the lower 2/3 are associated with the urethra, particularly the lower half of the urethra, which is firmly embedded in the vaginal wall. Posteriorly, the upper 1/3 is related to the pouch of Douglas. The middle third lies in contact with the interior rectal wall, separated by the rectovaginal septum, and the lower third is separated from the anal canal by the perineal body. On the lateral aspects, the upper 1/3 is associated with pelvic cellular tissue at the base of the broad ligament, where key structures such as the ureter and uterine artery run approximately 2 centimeters from the lateral fornices. The middle third is blended with the levator ani muscles, while the lower third lies in proximity to the bulbocavernosus muscles, vestibular bulbs, and Bartholin's glands. Structural layers of vagina. Let us now explore the layered structure of the vaginal wall, from the innermost to the outermost. 1. the mucus coat, which is lined by stratified squamous epithelium. Notably, this layer lacks secreting glands. 2. A submucous layer made up of loose areolar vascular tissue. 3. The muscular layer, consisting of an indistinct inner circular and an outer longitudinal muscle arrangement. 4. The fibrous coat, derived from the endopelvic fascia, and is noted for being highly vascular. Vaginal secretion and pH. The vaginal environment is another key topic, particularly its secretions and pH. From puberty to menopause, the vaginal pH is acidic, typically ranging between 4 and 5. This is due to the presence of datter lines, bacilli, which produce lactic acid from the glycogen stored in exfoliated epithelial cells. The acidic pH is regulated by estrogenic activity and plays an important role in maintaining microbial balance and protection against infection. Blood and lymphatic supply. The blood supply of the vagina is rich and complex. It includes the cervicovaginal branch of the uterine artery, the vaginal artery, a branch of the anterior division of the internal iliac, or sharing a common origin with the uterine artery, the middle rectal artery, and the internal pudendal artery. These vessels anastomose to form two azygos arteries, one anterior and one posterior. Venous drainage occurs via the internal iliac veins and internal pudendal veins. Lymphatic drainage follows a topographical pattern. The upper one-third drains into the internal iliac lymph nodes. The middle one-third, up to the hymen, also drains into the internal iliac nodes. Below the hymen, lymph flows toward the superficial inguinal nodes. Nerve supply. Moving on to the nerve supply, the vagina receives both sympathetic and parasympathetic innervation via the pelvic plexus. The lower part is also innervated by the pudendal nerve, which plays a significant role in somatic sensation, particularly near the vaginal opening. Embryological development. Finally, a brief note on the development of the vagina. The upper 4/5, which lie above the hymen, derive their mucous membrane from the endoderm of the canalized vaginal bulbs, and their muscular layer from the mesoderm of the two fused Mullerian ducts. The lower 1/5, below the hymen, develops from the endoderm of the urogenital sinus. The external vaginal orifice arises from the ectoderm of the genital folds following the rupture of the urogenital membrane. Summary. In summary, the vagina is a highly specialized structure, both in form and function. Its unique orientation, multi-layered composition, vascular and neural supply, and embryological origin all contribute to its vital role in the reproductive, excretory, and sexual health of individuals. Thank you for your attention. In our next session, we will explore the anatomy of the uterus and its clinical correlation.